Hello, you're watching The Big Story with me, Chow Su-en. Subscribe to the Straits Times channel to stay up to date with our live news updates. There is no need for Singapore to impose more COVID-19 travel curbs against Chinese travellers at this point, as current measures are adequate in protecting the local population, said Health Minister Ong Ye Kung. In Parliament today, he acknowledged that Singaporeans are asking if the Republic should adopt some of the measures other countries are implementing. This includes blanket pre-departure tests on all travellers from China. Mr. Ong explained why Singapore is not doing the same.
If we impose PDT on all travellers from China, questions also arise. How about travellers from other regions that contributed to more infections and severe cases? How about local community settings, which we know are conducive to spreading the disease and can drive infection numbers and severe cases? Further, by triggering PDT on travellers from one part of the world experiencing high infection numbers, are we contributing to an international precedent of imposing tests on travellers from countries experiencing an infection wave? So how will other countries treat travellers from Singapore when we encounter another infection wave? So instead of imposing blanket PDT specifically on travellers from one region or one country, we decided very early on that we should encourage adequate vaccination amongst all travellers coming to Singapore from all parts of the world. And this directly reduces the risk of importing severe cases and protecting our hospital system. And that is why we have until now maintained the requirement that incoming travellers either are fully vaccinated based on WHO definition or have to undergo a professionally administered or supervised PDT.
Meanwhile, addressing questions on how Singapore is managing the anticipated increase of flight and passenger flows into the country from China, Transport Minister S. Iswaran said his ministry has paced the resumption of flights to ensure that Changi Airport has the physical and operational capacity to meet those needs.
After China's recent announcement that it will reopen its borders and remove quarantine requirements for returning travellers with effect from yesterday, Singapore and Chinese airlines have applied to operate more flights between the two countries. CAAS is evaluating and will progressively approve these applications. As with other countries previously, we will carefully restore air connectivity with China, taking into consideration the prevailing public health assessment, as well as Changi's capacity, so that we can ensure efficient operations and a safe and smooth travel experience.
Today's ministerial statement raised a flurry of follow-up questions from members of the House. One concern raised by Aljunied GRC MP Leon Pereira was that of a possible overload on Singapore's already strained healthcare system, with a potential surge in imported infections.
So I understand that currently, in terms of bed utilization and ICU utilization, the capacity levels are very high, and for some of the public hospitals it's 90% or even well above 90%. So notwithstanding the regime of PDT and full vaccination, it would just take a relatively small number of cases coming in to possibly strain this hospital capacity to a very difficult position. So I'm just wondering if the government has thought through this extreme or worst case scenario that might happen with the opening up of capacity really being overstrained in the public hospital system.
Today, the number of COVID-19 patients, inpatient, is actually low. I can't remember, it's in the low tens. So it is actually not burdening our healthcare system. The healthcare system utilization of non-ICU wards is high because we are aging and just more people are falling sick. COVID affected that indirectly because it delayed the opening of some major public health facilities. Woodlands Healthcare Campus, for example, delayed for 2 to 3 years. We hope it can start opening end of this year. It will greatly relieve the burden that's currently in the high utilization rate of hospital beds.
The debate on COVID-19 travel restrictions comes even as Thailand made an abrupt U-turn on its policy, requiring visitors to the country to show proof of COVID-19 vaccination. This comes just 2 days after the measure was first announced and shortly after the first plane load of Chinese tourists landed in Bangkok on Monday afternoon. Thailand's health minister says that proof of vaccination is no longer needed as there is sufficient immunization globally. Those who have not been vaccinated will also be granted entry without restriction. Thailand's stance changed after tourism operators, especially in Phuket, complained that the restrictions had caused many tourists to cancel bookings. Before the pandemic, China accounted for 1/3 of all visitors to Thailand. With the relaxing of curbs, around 5 million Chinese tourists are expected to visit this year. This is, however, still less than half the number who arrived in 2019. And also in Parliament today, National Development Minister Desmond Lee said a range of tools is used to detect potential infringement of HDB rules, including when owners do not live in their flats for the minimum occupancy period. This includes random inspection of HDB units, whistleblowers, as well as the use of data and technology. Mr. Lee said that HDB received around 4,700 pieces of feedback on potential infringement relating to M.O.P rules between 2017 and 2022. All HDB flats that are involved in resale transactions are also inspected, with flats that have been found to be in bare or brand new conditions flagged up for further checks.
In detecting and investigating infringements, HDB tries to strike a balance. On the one hand, we want to ensure that HDB rules are complied with by detecting and deterring errant owners who infringe these rules, on the one hand. On the other hand, we do not want to overly impinge upon the privacy of the 1.1 million HDB homeowners, the vast majority of whom abide by the rules.
Speaking on the responsibilities of property agents, Mr. Lee also added that agents are required to carry out their due diligence to make sure no policies are infringed and to also inform their clients on the potential consequences. Disciplinary action will also be taken by the Council for Estate Agencies against agents who are found to have breached regulations.
Between 2017 and 2022, CA investigated 51 cases involving 69 property agents who had assisted their clients to market HDB flats, which might not have met M.O.P rules. Investigations into 32 cases have been completed, and CA took disciplinary action against 18 property agents who were found to have breached the code. 6 agents have had their registration suspended for between 7 and 48 weeks and received financial penalties ranging from $2,000 to $5,000 imposed by CA's disciplinary committee. 2 property agents were issued letters of censure, one of whom was also imposed with a financial penalty of $1,000. The remaining 10 agents were issued with warning letters for their disciplinary breaches. The remaining 19 cases are still under investigation.
And responding to members' questions on the incident involving the NSF firefighter who died in the Henderson Road blaze on December 8th last year, Minister of State for Home Affairs FAISHAL Ibrahim said that the late Sergeant 1 Edward Goh was medically fit and had some level of experience in firefighting.
He attained the gold standard for his individual physical proficiency tests and fared well in the other mandatory course requirements, including achieving an A grading for his breathing apparatus proficiency tests. His performance, in fact, was among the top 25% in his cohort. And like the rest, he would go through the process of the journey, like any other SCDF and SF. And in fact, his experience when he was posted to the Central Fire Station in May 2022, he had attended nearly 60 fire and rescue calls. So he was an officer with some level of experience as well.
Associate Professor FAISHAL also gave details of the firefighting operation, noting that the police are currently conducting an independent probe into the circumstances of Sergeant Goh's death. He revealed that 40% of the respondents deployed were national servicemen, with regular officers making up the remaining 60%. In all, 22 emergency vehicles and 61 respondents from 6 fire stations were sent to fight the blaze. He also said that the arrival of SCDF officers to the scene was delayed by 18 minutes as the fire engine access way leading to the block was obstructed by a tent where a funeral wake was being held. And in other local news, the 42-year-old man who took a 60-year-old woman hostage in YISHUN has been arrested. The knife has also been seized after the incident earlier this morning. In a video on Facebook, the man can be seen at the void deck of Block 108 YISHUN Ring Road, holding a knife to the woman's neck as police officers tried to calm him down. They eventually managed to pin him down to the ground and arrest him. The woman sustained minor injuries but refused to be taken to hospital. Based on preliminary investigations, the man and woman do not know each other. And those are our top stories for today. Visit straitstimes.com for more news and our YouTube channel for more videos. Subscribe by hitting the red button below. I'm Chao Suen, and I'll see you tomorrow on The Big Story.